Today we will discuss about these neoadjuvant immunotherapy results on non-small cell lung cancer, which is shown in this panel A, which is the H&E staining of the patient who got treated with this immunotherapy, neoadjuvant immunotherapy, and the probable mechanisms that might have occurred is shown in this panel B, and what are the results we are expecting is shown in this panel C. So we will start with this H&E staining, which is the photomicrograph of the H&E staining of the patients who are treated with this neoadjuvant immunotherapy. So these are the residual viable tumor, and here this H&E staining is annotated with the cells which are important or that take place, that has a role in this neoadjuvant immunotherapies, or that has a role towards tumor suppressions. This is the residual viable tumors sites, which is shown here, and this is the HEV, that is high endothelial venule. So this HEV role is to traffic this T cells and the B cells towards this tumor microenvironment. At the same time, it also helps in the priming and the activations of these T cells. So what happens is this: in the neoadjuvant immunotherapies, these HEV-like vesicles are being transported to the tumors so that it can attract or it can traffic more T cells and B cells to the side of the tumors. And at the same time, since it has the informations, or it can suppress these PD1 receptors, a PD1 ligand on the tumor cells, so it will also prevent the deactivations of these T cells and B cells or the immune cells from the tumors which contains these PD-L1 receptors. So here the HEV has been identified, so it is able to suppress this tumor sites and these tertiary lymphoid structures. So this HEV is usually found in this in these tertiary lymphoid structures because it can its also role is to traffic the lymphocytes also to the side of the tumors. And here are the stromal plasma cells that is shown here, and the lymphocytes, and here is this neovascularizations, or we can say the this neoadjuvant immunotherapies effect is going on in terms of this activations of the T cells at the secondary site. So these things we have briefly covered in our previous video also. So the main mechanism, or the mechanisms in brief, is also shown in this panel B, where we can see that the HEV is shown here. It is this high endothelial venule, so its job is to this T cells priming, at the same time activations. And once these T cells along with these B cells also activated, then it will translocate those activated T cells and B cells to this residual viable tumors through this effector memory T cells in the form of effector memory T cells, or this circulating memory T cells, B cells, and the plasma cells. And they will these T cells will release the cytolytic factors, and this also this stromal plasma cells can directly interact with this residual viable tumors to reduce this residual viable tumor sites. So the circulating usually the circulating of these memory T cells and B cells usually occurs through this angiogenesis or more blood vessel formations. At the same time, what it will does is it will also these B cells will also mature its cells and cause these neovascularizations at the secondary sites that will attract more different type of immune cells such as macrophages to the site of the tumors. So this is the primary mechanisms that is shown in briefly in this panel B, and in the panel C it shows how this residual viable tumors will look like if this neoadjuvant therapy is working successfully on the patient. So initially it will have this this whole region of the tumor is considered as this residual viable tumor. So it is 100% tumors, and thereafter with the decrease in the residual viable tumor or the killing of the tumors, the tumor sites occupied in this region is reduced to 50%, and thereafter to 10% and 0%. We can see that with the decrease in the residual viable tumors, there is an increase in the number of blood vessels, or new blood vessels are formed, or we can see that angiogenesis occurs, and this angiogenesis will help in the helps in the transport of these B cells and the T cells to the site of the tumors. Thereby, it will further increase the efficacies of these neoadjuvant immunotherapies on the tumors. So this is how the mechanisms of this neoadjuvant immunotherapies might work, and a brief results on the patient who is affected with this non-small cell lung cancers underwent neoadjuvant immunotherapies is also shown here. This is the photomicrograph of this NSCLC patient who underwent this neoadjuvant immunotherapies. If you need to understand more about this mechanisms and their results in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.